Hi, folks. We're going to give it just a moment to get started. But thanks so much for joining us. As folks come in, we always love to hear who's in the virtual room, so feel free to use the chat box. And yes, some good reminders in the chat from our team about the Q&A feature. Hopefully we'll have some good time for questions in this session. All right, so while folks are still coming in, I do think we'll go ahead and get started. So hello and welcome to this webinar focused on healthy eating conversations with older adults. This is the National Center for Equitable Care for Elders activity. My name is Ariel and I'm the program manager. We are so pleased to have a special guest speaker with us today, Tara Hammes, who's from the Massachusetts Council on Aging. We're going to have a presentation today that kind of goes back and forth between the two of us, hopefully some really good conversations about this topic. We also would really love to hear your experience, so feel free to use the chat box again to talk to us about your knowledge in this area as well. So before we go forward, I'm going to read Tara's bio so we all are on the same page. Tara Hammes is the Director of Member Services for Nutrition and Healthy Aging with the Massachusetts Council on Aging and member of both the Massachusetts Public Health Association's Policy Council and the Massachusetts Commission on Malnutrition Prevention among older adults. She's been a registered dietitian for over 20 years and spent the last 10 years working on older adult community nutrition programs, which makes her an excellent resource for us in this session today. So if you are not familiar with our center already, we provide training and technical assistance primarily to health centers, but also to community-based organizations around older adult health and well-being. If you want to check out any of our other learning opportunities, feel free to access any of the links on this slide. We'd love to stay in touch about future learning opportunities. I always like to plug the Health Center Resource Clearinghouse, a great one-stop shop for information on patient care and other things relevant to health centers, including healthy eating, chronic disease management and prevention, amongst other topics. Just some reminders, we're all very familiar with Zoom at this point, but we have lines muted just to prevent background noise. But again, we would really love to hear from you. This is a topic that folks might be familiar with as far as guidance around nutrition, but we're trying to dive in more deeply today on how we really have these conversations with older patients especially. So if this is something that your role focuses on, we would love to hear from you. So feel free to use the chat box or the Q&A feature, especially if you want to pass any questions along to Tara. This webinar is being recorded. We'll make sure that all attendees have access to the slides and the recording after the session wraps. And then, of course, we would love to hear your feedback. Once the session closes, you'll get a chance to fill out a very short evaluation. We'd love to hear your thoughts, not only on this session, but about other topics you might like to see in future learning opportunities. So with that being said, these are our learning objectives that you saw when you signed up for this webinar. Again, we're going to try to briefly do some level setting on nutritional needs for older adults. It is good to be on the same page about that, but then we really want to talk about some of the complexities for older patients in achieving goals around healthy eating, different factors that influence their preferences and their and potential barriers to healthy eating, maintaining that. So then hopefully being able to talk about some strategies, community resources focused on older adult nutrition and addressing malnutrition. So looking forward to this discussion. So I'd like to start out just very briefly talking about how this type of webinar fits within this concept of what it means to be an age-friendly health center. If you're from a community-based organization, then kind of an age-friendly organization. If you're focused on health in any way, you'll see this 4Ms framework from the John A. Hartford Foundation and the Institute for Healthcare Improvement. it really focuses ultimately on what matters for older adults. That's kind of what I want to point out on this graphic first and foremost. These other M's in this framework also are important for older adult healthcare, but we want to prioritize what matters for older adults. And there's a great movement within, again, IHI and John A. Hartford Foundation to enable health centers especially to be able to look at their current programs and policies and see how that supports healthy aging, where there's opportunities to adjust and focus on those needs. So I do think that talking about nutrition and lifestyle behaviors all fits in within that framework. So just a quick plug for that. Want to start out with a quick poll question. So since we don't know everyone who's in the room, kind of what your roles are, I'm curious how often you might discuss healthy eating with your older adult patients or participants. And if it's something where you're just kind of coming here to learn and you don't have these conversations, you can always say other, or if there's another reason to say other, feel free to put that in the chat. All right, whenever it feels good, wrap the bowl up. Okay, so an interesting mix. I would love to know if there's something other than I don't have those conversations with older adults. Would love to see that in the chat. But yeah, it's an interesting mix. A lot of folks say every visit, which is, I'm sure your role may be in something where you're working on goals together, you're thinking about resources. I don't do direct service. Yeah, no problem. Thanks, Dakota, for sharing. So that just helps to give us a sense of who's in the room. And so you can take from this information what makes the most sense for you. If it's something where you're not always having those conversations, but you might want to pass along information to those who are, I still think it'll be very helpful. So sometimes within a healthcare setting, the conversations around healthy eating may come in the context of preventive care services. So you'll see this screening measure for BMI. I contact my patients on a monthly basis. Oh, great. Thank you, Teresa, for sharing. That's excellent. These bullet points here are just from this standard language of this screening measure for BMI. There's a lot of limitations to BMI. We'll talk about it briefly, but I'm just mentioning this to say some of you may be keeping this in mind as you discuss lifestyle behaviors with patients. If there's older patients with a BMI higher than 30, you might be then saying, okay, let's think about interventions, let's think about a plan together. So hopefully some of our discussion today will help give some context for ways we can navigate potential barriers. Part of this clinical recommendation does mention that behavioral lifestyle intervention should be tailored to a patient's ethnic, cultural, socioeconomic, educational background. So that's really important. That's going to come back again as well. I think we're all very familiar, even from our own experience as patients within a healthcare system. We see the BMI chart here. I'm only really saying this to say, again, many of you may be using this as a way to know whether you need some discussion and follow-up related to lifestyle behaviors. Just wanting to mention that, especially for older adults, it's important to remember that BMI doesn't completely account for age, sex, activity levels, might overestimate or underestimate the degree of obesity, especially for older adults with changing levels of muscle mass, fat stores. And so it doesn't give us a full picture of health, but it can be combined with other measures. So just wanting to make sure we're on the same page with that. I think we are familiar with some risks of being overweight in general for older adults. We aren't going to spend a lot of time on that. What I do want to have these basic bullet points here. In addition to some of the health conditions, you see limited mobility may be a concern as well, but there really is also risk on the other side of things. So the risk of being underweight for older adults. I'd love, Tara, now that I've just chatted a bunch, I'd love for the group to hear, especially on this angle from you in your experience as a dietitian, especially. I think so often when folks in general are talking about, again, BMI screening, thinking about healthy eating, sometimes the underweight concern gets lost for older adults as they age. So I'd love to hear anything you have to say around that.
3 years now, and I'm muted. Haven't we all mastered the mute button by now? Hi, everyone. Thank you for having me. And I think you're absolutely right. There are risk factors for being overweight, overfat, or underweight, and having sarcopenia, which is not having enough protein. And a lot of folks, this is where it gets them in deep trouble. That is where they may not have an appetite for a number of reasons, and they aren't eating enough, and specifically not eating enough protein, as well as not eating enough of the vitamins and minerals that we need. So if we don't have the muscle strength, I always bring this up, we're one bad fall away to starting that downward spiral. And it's not a pleasant thing to think about, but it happens too often. So how do we make sure that our clients, our patients, can remain living in the community for as long as possible? And one of the ways to do it is through proper nutrition. So that's why we try to look at it from either perspective. And even if someone presents at a normal weight, and you're absolutely right with the BMI, it's a tool. It has benefits and weaknesses. It's a starting point, right? Even if someone falls within a normal BMI, you still want to talk to them about, are you eating the things you're supposed to be eating? The last thing we want to do is make our health worse by, and I know this goes for many things beyond nutrition, by not taking the steps that we can to stay as healthy as possible, stay as strong, stay as sharp. So yeah, that's my long-winded way of saying there's risks being both overweight and underweight.
Got it. Yeah, absolutely. I like this graphic. I think that we'll touch on some of these elements as we go forward, but just wanting to, and I'm sure there's many, models that Tara has seen in her work, but thinking about, at the bottom here of diet quality. So if we're just talking to the patient around, okay, what are you eating? What foods, do you normally have in your meals? Like we might be judging on, okay, that's good food, the right food or the wrong food. But then we see all these factors kind of upstream here. So our habits obviously influence our diet quality, but what influences our habits? We see these two elements of personal factors. So our mood, our motivation, as well as our social engagement. So we think a lot around the social needs of older adults, especially if they are isolated or if they're feeling those subjective feelings of loneliness, who they may have those connections with. Those are going to influence the habits that influence the diet quality. But then we look further up and you see this bidirectional relationship with all these other factors. We won't have enough time to unpack each of these, but I think it's important for older adults to mention what have they believed historically about eating? And then what are their current beliefs around their own bodies, around food? When it comes to life transitions for older adults, that's such an important consideration. If they are grieving a loss of a loved one, if they are transitioning from working to retirement, there's lots of things there that can influence those personal and social factors. Age-related conditions. We'll talk about some physical causes of poor nutrition briefly in this level setting portion, but that's something to consider. And then the environment. We know, especially from a community health center perspective, how often folks are not having access in the neighborhood and built environment to the right types of food. Obviously, there are community partners that make that easier for many patients. But anyway, it's a good overall picture to say that it's not enough just to look at diet quality.
And Ariel, I would add to that too. It's not, there's portions there that's bidirectional, but it's not linear either. You can have a multifactorial influences, as we all do.
Yeah, absolutely. Absolutely. I won't spend too much time on, I think that so many of us have not only lived through much of the pandemic, we've worked through, especially those working in a health center setting. We all really understand by now the impact of the pandemic on everyone, but just keeping in mind for older adults, there's a lot of factors that may have been exacerbated during the pandemic that could then again trickle down and affect poor nutrition in some way. I don't know, Tara, as far as just kind of quickly giving folks anything you want to highlight as far as, again, there's those personal social factors, but there could be some physical causes for older adults as well when it comes to poor nutrition. Is there anything you want to particularly highlight here?
I think these are great. What I would do is add some things around motor function, specifically if someone has had a stroke and they, have a left side hemi weaknesses. That's going to change how you shop for food, how you prepare for food, the ability to open cans. I know I'm preaching to the choir, but for some folks, it's, I hadn't thought about that. In a lot of training for community health professionals, they have you, spend an hour in someone else's shoes, maybe, using one eye and limiting the use of your dominant side and seeing how well you would do just trying to eat with those two factors. So there are a number of physical causes that are going to impact us, our diet quality, I would say. And dentition is a huge one for me, because sometimes you can tell if someone has mouth pain and sometimes you can tell if their dentures fit or don't. And that is just a huge oral, going into the whole oral health arena is for another day.
Yeah, absolutely. So just quickly, we are going to mention some of the federal nutrition programs towards the end. We're talking about resources, but just I do think it's important to consider the impact of social determinants of health on nutrition, especially when it comes to food insecurity. This has been a problem before, during, and not really after COVID, as we're moving into a different phase with COVID. So we will talk about, connecting older adults to available resources as they are really underutilized, but we've seen again, the impact of hunger, poverty, and then health. So I like this little graphic, and thank you, Juliet, for linking the full report here. So again, I know this session is really, we're wanting to have folks think about these conversations. It's important though to make sure there's a little level setting with what is it that we're talking about as far as that the baseline of the nutrition standards. I'm not going to focus too strongly on this. I want to just give a snapshot of, hey, these are the guidelines that we have. Is there anything, Tara, you would say with these in general for folks?
I would say go to chapter 6 and print it out and go to one of the attachments that has the food lists, because a lot of people will say, oh, I need, more protein. So what does that mean? Beef? No, there are lists, food lists inside of some of the appendices that you can use.
Yeah. Excellent. There's obviously with general resources for the general population, adults, but there is this My Plate for older adults. You can see that developed by Tufts, ARP Foundation. This is available to download in multiple languages. I know Juliet just put in the chat. Many of these recommendations might feel really familiar to us. It can be nice to have the visual. And so that'll be kind of what I say. I know that, as Tara's mentioning, there could be other resources that you're downloading that you're seeing as a reference. This is a great way to visualize. That's taking into account some of those unique nutritional needs that older adults have.
One of the things Julie or Ariel, we hop back to them. One of the things I like about this resource is that they specifically, earlier than others, made sure to emphasize fluids and activity. And I think that fortunately is better emphasized now across the lifespan, but it was great to see it really happen via Tufts for the first time in this infographic.
Yeah, that's great. Yeah, you see that in the bottom there. Remember to stay active, and then the picture of the fluids. Great. So we're almost there. We're almost there to the conversation about, around conversations. But I do want to put this here for thinking about goals. I know I shared that quick graphic about what makes a health center age friendly, the 4Ms framework of what matters to older adults. I just like this as a thought process. We may have goals in mind for the older adults we're working with. We may be like, great, we want them to maintain a healthy weight. What does that look? What does that translate to for an older adult that might be motivating for them? Maybe it's that they want to stay as active and independent as they can. That might be even more appealing as a framework than just, oh, maintaining a healthy weight. If we want them to manage or prevent chronic conditions, they likely want to do that as well, but they might be able to spend less time with doctors and medical professionals. And then boosted energy and mood, pretty self-explanatory, but maybe it means they're able to engage with their activities more they like in their community. There's ways we can think about or really engage with patients themselves to elicit some of that that feedback from them, so we know, oh, this is what's really motivating for you. I may need to change the way that I'm even framing it in our conversations, or just food for thought there.
I really like that, because it's finding out what matters to them. What is not just what's the goal, what's their goal, what's important to them. I know that I love that there's more of a focus now on staying active, being, I'm blanking on the term, but I'll come back to it. Instead of trying to hit the gym 5 days a week, as one may have at another time, maybe now you just want to be able to bend down without feeling the pain in your knees creaking.
Mm-hmm.
So it's fine. Whatever is their goal, that is what we're going to accept and go with.
Yeah. And we can definitely see how it may be able, folks may be able to maintain change over time if it's something that really resonates with them. So that's so, yeah, important for it to be personalized. So we're going to jump into focusing on these conversations. I just have these here. There's a fact sheet that's linked that goes through much of this. I think it's a great resource. I won't go through each of these individually, but these are all potential starting points. It's an exploration of really what makes up someone's current habits around eating and nutrition. So it's so important to know who else might be with them in the shopping, cooking, eating experience. If there's a caregiver, that's such an important consideration, especially if you're trying to give guidance for someone when, around shopping, preparing food and eating food. And to start to figure out some barriers that they can identify for themselves. I know we'll go into a conversation around moving folks towards change, but is there anything here, Tara, that you would say around initiating that conversation?
I think these are all really good examples. And we get into a little bit in just a minute about wanting to use a lot of open-ended questions, but that doesn't mean that your first question has to be an open-ended question. It's okay to start the conversation with, something who specific and concrete, who does the grocery shopping?
Yeah. Yep, absolutely. All right. So we have another poll question. Really is just to get a gauge for what folks' experience has been before coming to this webinar. Almost an even split. So that's very interesting. What I'll say is that this webinar does not take the place of a training on motivational interviewing. If you have had training before, I think this will be a nice little refresher in the context of conversations about healthy eating. I always say that you really can't have enough time in thinking about these techniques, but I'll say that, motivational interviewing for those who haven't gotten training in it, and Tara will take it away for us to discuss this more, but it's a patient-centered counseling style that helps them to explore and hopefully resolve ambivalence to change. So it can be used in a lot of different settings. A lot of times you'll hear it talked about with like smoking cessation, other challenges that people might be experiencing. But I see we have someone with their hand raised. Do you have a question? Amy, before we go on? If not, if you want to put something in the chat, that's excellent as well. All right, well, thanks folks for responding. I'm going to let Tara take it from here.
All right. And that's also to say, piggybacking on what Ariel said about the motivational interviewing, you will not leave here an expert. I don't know anyone who is an expert, but we're all going to give it our best shot. Before we get into that a little bit, I want to talk about communication in general. And I loved this analogy because my great grandmother was actually an operator on the switchboard. And so I want you folks, if it feels okay, to think of yourselves as Sadie as well. And that is realize that you are not just part of the conversation, but also a conduit to it. You are listening to what folks have to say, and then you have to take an action. And that is, you're going to have to decode what they're saying and figure out what direction you want to take them in. Where do you want to plug them into? So if I'm calling Ariel, I'm going to say to Sadie, hey, I need 27th Street Northwest. She has to make sure that she plugs me into 27 Northwest, not Northeast. So it's really listening and then taking the right action. You can go to the next slide, where this is something that I absolutely love. My undergraduate degree was in communication a few years ago, and this has always stuck with me. And that is a really simple model around two people in a conversation, however you want to define conversation. So think of yourselves as the sender, or the patient as the sender, and then we'll go with you. They're encoding of the message, right? So we know what we want to say, but first we have to encode it. And are we using our actual voices? Are we using sign language? Are we using animation, cartoon? And then you're sending the message through a channel. And so the channel can be, your actual voice that you're going to use. So you're thinking of your message, or you're using English, you're sending it through. Are you using any photos? Are you using your hands? And at the same time, while you're trying to convey the message, there can be noise. That's the interference. And that can happen when you're sending and receiving it. So you think you have the message, you formulated how you want to get it across, and then it goes to the receiver, but then they also have to decode it. So maybe English is their second language, maybe that they are hard of hearing. And then all of these factors can determine how well your intent was received, what the message was. Similar to the telephone game, right? They receive the message, and then they encode a response back to you in a similar fashion. And again, there could be noise. Their phone could be ringing in the background. There could be children. You could have mispronounced a word. And that actually, I don't know if that ever happens to you guys, but if I hear somebody mispronounce a word or say something that clicks with me, and then I sort of drift off a little bit, I'm like, oh, shoot, I just left off. I have to catch back up. But sometimes those little things will happen, and that's the interference. That's the action. And then again, the sender is going to receive it. And so this continues on and on and on. And I'm sure it's happening right now while I'm trying to talk to you. You're like, why is she using her hand so much? Why is she looking around? What is going on? So that can be some of the interference. You're like, what is she really trying to say? And what I'm trying to say is that it is continuous quality improvement. There's always some feedback going on. And we have to be very cognizant that when we're trying to give something to someone is not as straightforward as them to reaching out their hand and accepting it. And it takes practice. I saw something funny, and I hope no one gets offended by this, but I thought it was funny. It's a great example. It was a joke about a woman saying that she went out to start her car, and the car wouldn't start. And she texted her husband, and she said, I don't know why the car won't start, and why there's a person sitting on the toilet showing up on the dashboard. And this was the picture. So the car wouldn't start because it was -4 degrees out, but she immediately thought of that was sitting on the toilet. So I thought that was kind of silly, and I hope no one's offended. Okay. Thank you for playing my reindeer games. All right, on the next slide. So we did talk about some physical causes to eating well. So I want to know what you hear as some of the barriers. And the reason I ask is because that's part of the reason why we decided to have this webinar, was because as a dietitian, as a community health professional, I feel like there are so many other factors that folks overlook. Probably not as much as you folks do because you are in the community. I'll say one of the things that I often heard as a barrier to healthy eating is that folks didn't have a full kitchen. You're not going to provide the same foods from a food pantry to someone who has a full kitchen, to someone who's in a shelter and might only have access to a microwave. So that's just one barrier to healthy eating. But I would love to see in the chat what some of your experiences have been around those barriers. Cost of groceries. Oh my goodness, Barb. Absolutely. And that's for everyone, right? Absolutely. And the prices are not going to go back down. It's when does that happen, right? So there's the cost, the availability of healthy food, right? Whether you call them the low income, low access areas, the food deserts. We have year-round produce in most of the country, but there's a lot of areas that don't have similar selection, or there might not be the knowledge, the time to prepare a meal. Whether you are, okay, we're all kind of short on time and energy sometimes. You're cooking for one, it's no fun. If you have to cook for a large group of folks and you don't have the time and you're working 2 jobs, absolutely. What else? I saw somebody else said, spouse, you're eating different things. Oh, cooking for one. Transportation, that's exactly what I was thinking of before. So if you don't have transportation to get to the grocery store, that's going to impact your diet, your eating pattern. Absolutely. So all of these factors, and don't we wish we could just wave a wand and solve them all for folks? Sometimes we can solve them, sometimes we can't. But at least we're having that conversation to try to figure out ways to assist. Okay, thank you for your feedback. And now let me take a little, okay, so let's talk about MI. As Ariel said, it is client-centered. We do use open-ended. We want to find out what their reasons are for doing what they're doing. So we're identifying those goals. And by doing that, we're building trust. We are improving our rapport for folks, because the more you trust someone, the more they are going to be open to what you have to share. And the more they know that you care about their situation and really want to help, the deeper that's going to get. And the more you're going to find out the details that you need to help folks. We don't want to skip to the good part, right? We want to walk that path with folks. We want to find out how they feel about their goals, not just, my spouse doesn't want to eat healthy, but you want to eat healthy. So how does that make you feel? Just saying that out loud gives me goosebumps, because it can be so emotional. And we want to support folks in any way. So like I said, don't jump right to the planning phase. Walk with them, hold their hand, and find their motivation. And you'll know once you hear that nugget, continue on and let them do the talking. See, I can stop talking once in a while. Yes. Okay. Thank you. All right. So there's 4 principles, and I know these slides are a little text heavy for me, but I want to make sure that we go through them one at a time. So there's 4 principles for motivational interviewing. The first one is to express the empathy. Let them know you understand where they're coming from. Here are some examples if that's unfamiliar to you. You can say, that sounds really challenging. You could say, you're stuck in a tough situation and I see why you feel upset that your spouse won't eat healthy with you, whatever that is. So you're empathetic. You also want to be discreet. I'm sorry, not discreet, sorry. Discrepancy, develop some discrepancy, help focus on the goals instead of where they are currently stuck. You want to assess, but also move forward. So what are some good things about eating ice cream nightly is something I might say to my brother who is trying to get healthy, and he will list those. And then I would ask, what are some of the less good things about eating ice cream nightly? And then they might be able to identify what those are. What are some potential benefits of eating ice cream one night a week? And so help you ask the questions and help them identify the answer. So develop the discrepancy. What's good about it? What's bad about it? And what are some benefits about making those changes? You don't want to, I was just going to add that you don't want to pressure or use any scare tactics for them, but make space for their concerns.
Absolutely. I think my favorite phrase that I've heard with developing discrepancy is helping someone see the space between where they are and where they want to be, not hopefully in a daunting way, not in a like, oh, you have all this space, but to explore, what are our current behaviors, what's a goal that you have, and to see, oh, those are different. Not in a judgmental way. Again, it's making sure the framing is right, but I really like the, identifying that there might be a space in between where we are and where we want to be.
Right. And that would be the first step to taking all of the steps that you need to take. And they're going to be baby steps, and baby steps is what is going to get the job done. I always say in my head while I'm running, slow and steady wins the race, because I just want to be out there and do the work. And to get to where I want to be, we can use that similar mantra if you'd like. Okay. So the next two principles are to roll with resistance. Change can be difficult for all of us, especially when we're paying out that extra $1 at the grocery store. Acknowledge resistant feelings and thoughts without judging them. You seem to feel hopeless about being able to buy healthy food. And then however they respond, you can keep listening. The fourth principle is to support their self-efficacy. So support their abilities to make the changes they want. You might have a picture of where you want them to go. You might think that they can do blah, 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 blah. But find out what they want to do and what their plan is if they have one. Or even if they haven't thought of it, at least you can start, you plant the seed. It sounds like you have a good plan in place for the next 3 months. So even if you're thinking, okay, in a year from now, you should look like this, or you should have done that, support them for taking that first step and looking at that short-term piece. You're going to be a collaborator and support their efforts.
Mm-hmm. What I love about the concept of self-efficacy too, and I think about it for myself a lot, is that just like the belief in your ability to do something, even if you haven't done it yet. So it's okay. It's okay if you've never done it before. But if someone feels, I can do that, that is so important. that belief is so incredibly essential to that next act, taking the actual step. So encouraging where even you see that person say, that sounds realistic for me. Like that is like a yes, absolutely love that plan. Yeah, that's great. That's a great
I
thing.
love that. Yes. Yes. It's the manifesting that folks are saying now, right? I'm manifesting. So we also want to use some of the techniques in motivational interviewing, and it's abbreviated as OARS is an acronym. So you're using the open-ended questions. What do you like? What would you like to do for your health this year? What would you like to change about your eating patterns? What else can you share about that? Again, you can use the open-ended as a starter, but you don't have to. But the more open-ended question you ask, the more conversation, the more back and forth you will have. Just think about it. Like if you're trying to have a conversation with someone and they're like, yep, nope, yep, like they're here, they want to get out of the health. They check. It's a lot harder to do when you're using the open-ended questions. Always make sure you use some affirmations. Thank them. Thank you for coming in. That's a great step forward. I'd find that difficult too. You want to be empathetic again. Use reflections. Repeat back to them what they said with a bit of your perspective. So it's a little bit of active listening technique, right? We all use that to some degree, but making sure we use it here is going to be impactful. So it seems like you want to have ice cream every night because it's better than drinking every night. Or why don't you want to give up eating your ice cream? What will you miss? What will that mean to you? What will you do instead? And then also summarize, repeat back to them what you think that they said to you. And that can be part of that communication model as well. Again, we're not going to become experts in motivational interviewing today, but these are some techniques that you can use as you feel comfortable. You can practice them every day and just keep it in your toolbox. So with that in mind, don't worry, it's not group work. Just have a little activity for you to use in your comfort of your own screen. Think of an older adult, whether they are someone in your life personally or professionally, if they're a client, and think of what health behavior do you think that they have to improve, right? So you have an individual health behavior that they can improve, and then how you think it should be fixed, or what are some resolutions, right? So step one, you're going to think of that person. Step two, what is that activity? And step three, how do they make those changes? Step four would be to tell them how to do it, right? I hope everyone's saying no, because we just went through the last 30 minutes talking about how we need to get them there. So that's the last thing we want to do, is to just tell them. We want to find out, we're going to walk with them. And so in doing that, you can use one of the 4 MI spirits, which is on the next page, and approach them with collaboration. You can not impose the change, but encourage them to want to make the change themselves, accept where they're at, be compassionate. Again, help them get there, not help them get there, help them get there, right? Because they have got to be the ones that want to get there. Get them talking and really, really listen. I think it is a professional trait, detriment is as a dietitian, and tell me if you've met a dietitian who doesn't do this. We have so much we want to tell you. We want to tell you every single thing in 15 minutes, and then we know that you're going to retain it all and off you go. But that's not really the way it works. We need to tell you a little bit, listen, hopefully truly listen, and really help you get to the place that you need to be. Any questions on that one? I mean, it's pretty straightforward, but it's harder to do in some areas than others. We need to acknowledge that. Ariel, have there been any that you can think of that have come up for folks? In positive or negative?
Yeah, I mean, we have had a couple of learning collaboratives in this area. Are you thinking about, specific behaviors that are most challenging? Yeah, see, I mean, I think it's just, we've heard definitely that just consistency. I think that there could be some folks who like to try a new behavior when it comes to a lifestyle behavior, and then it's just maintaining it over time, especially for health center patients that may be navigating a lot of additional challenges, that like the intention might be there of like, oh, this is, yes, I agree that this is my goal, this is something I want. But that level of confidence that they're going to be able to follow through with that behavior on a week-to-week, month-to-month basis might be lower. So we definitely have heard that through some of our other learning opportunities in this area.
Yeah. Especially when it comes to food, a lot of folks are more concerned around housing and transportation and a bunch of other issues, maybe surgery, who knows what else. And a lot of times food is the piece that we'll get to that later. It'll come last. And that can be difficult, but very reasonable. completely makes sense.
Sure.
One of the ways I like to think about this activity also is, you're using those open-ended questions. And a lot of times folks will avoid and not really want to have the conversation. They'll want to evade. But I think of it as the practitioner being the child, and the child will keep asking why. You want them to be the child to get them to the why. So, why is the sky blue? Why? So you can like drill down until there's that concrete piece of information that makes it understandable. And they're like, oh, okay, I got it. And then the light bulb goes off.
And that's where having that rapport with a patient goes a long way. So it's not feeling like an interrogation, or it's not feeling like a judgment, but a genuine exploration with someone who has established that, hey, I care about you. I'm invested in your health and well-being, and hopefully over time someone's comfortable, because it's some of those whys could have initially be like, ooh, I don't know. It feels uncomfortable to explore that. But if you trust the person asking, that's going to go a long way.
Yes. The uncomfortable, the change.
Yeah, I agree, Amanda. The tone. Yes. Obviously, if you're like, especially if you haven't had that established rapport yet, that's a very good consideration for
tone and delivery are crucial. Crucial. Yes, Amanda. Perfect. Okay. 2 other pieces that I've been using lately that I think so far in the short period of time that I've been sharing this with folks come from the Atomic Habits book by James Clear. I don't know how familiar folks are, but one is that small changes can have a large impact. And the example he uses is, well, first of all, the reason that we want to do that is because small changes can really provide us with those stepping stones that we need to really make the progress. We say, we got to sit down and we got to write out what we have to do, but really breaking it down step by step it really does make it feel more manageable. I know that's cliche, but it's true. And a great example of the small changes having a big impact is if you are piloting an airplane and you have to fly from Los Angeles to Washington, D.C. And let's say you have the nose of the plane pointed off in the direction of, 3 yards. So you're 3 yards off when you first start out to fly. Now we know that flying is not as direct, A to B. We've got the curvature of the earth and the rotation and all of that. But if you think of it as if you start off just a small little bit after 2,000 miles, let's say 700 miles, you can wind up way off course. So those small changes are going to have a big impact, whether that's a positive or a negative. And the other piece that I think really hits home these days is encouraging folks to, adopt that new mindset. Mindset's one thing, but think of yourself as having a new identity. So it can be goal oriented, it'd be outcomes oriented, or identity oriented. And I think identity oriented is more successful because we can say, I want to lose 20 pounds. So that's our goal, is to lose 20 pounds. Okay, great. Then what do you do once you get there? Okay, you've lost the 20 pounds. Or you can say, I want to be someone who, and these aren't the same things, I know. You can say that I want to walk more. Okay, so what are you going to do? You're going to walk 3 miles a day. Great, you hit the goal. Or you can change your identity and say, I am a walker. So what does that mean? So I'm a walker. So that means that I have a habit and I get up and I take a walk every day. And that becomes my new behavior, is that I walk in the morning every single day, and that I'm taking these daily walks because I'm a walker. So the more you have the habit and change your behavior, you're going to change your identity. And then to maintain your identity, you're going to keep taking those, making those behavior changes. You're going to keep doing that same thing. And I think that helps a lot too. We can say, I'm a looking at the shopping carts, a vegetarian or a vegetable eater. That's because I make salads every day or whatever it is. But along those lines, it really is a change in your mindset. And with the habits, you can stack them or you can replace them. So let's say you are already a walker, but you don't drink enough water. So you can say every day before I go out the door, I'm going to have a glass of water. And when I come in the door after my walk, I'm going to have a glass of water. So then you're going to be more hydrated throughout the day. It can be having that glass of water when you wake up or when you go to bed at night. I already hear what you're thinking about drinking the water before bed at night. Just an example. Okay. So I hope those two helps, but I really like them.
Yeah, absolutely.
And Ariel, no, go ahead. I was just going to say, if you want to go ahead, and I will take a break and have a sip of water.
Perfect. All right. So we have 10 minutes. We're going to quickly wrap up kind of the content that's focused on the conversation, and then think about kind of how we then are connecting folks with their next step, their resources, additional information based on what's available in your community. I won't spend much time on this. It's just more of like examples of what Tara was talking about. We're really wanting the patient, we're wanting the older adult in the conversation to start talking in a way that indicates they're open to change. So there's some examples here related to healthy eating, something you can take a look at on the slides. But I do just want to mention the importance of follow-up. I think we all understand the importance of follow-up, but to put it in the context specifically of healthy eating conversations, if you're setting a goal, so like Tara said, depending on your conversation, did you put together a SMART goal, or did you say, okay, we're talking about our identity as a walker, as a water drinker, as a whatever. The next time you're talking with someone, and a good number of you say that you do talk about healthy eating at every visit you have with them, which of course there could be, different increments of time for that. But I like this graphic of when you're checking in, it could go a few different ways for the older adult. They could have done it, they could have partially done it, or they didn't. But you see how it all still filters down to the question of what would you like to do next? So we still have a role in this relationship to celebrate success, to celebrate they got part of the way. That's fantastic. And also to make sure they feel like, disruptions are normal. It's not if, it's when. Disruptions happen. So it's normalizing that, it's ensuring that that's not going to deter someone from thinking about what their next step is. It could be that you need to have a goal that's more realistic for where they are currently, or there's additional supports needed. But I just like this idea of always pointing towards, okay, what's our next step? We didn't just reach a goal and we're done, or we didn't fail, quote unquote, and then we're done. But let's think about where we're going forward. So again, if you're having these recurring conversations, there's such a fantastic role for you to be a partner with the patient and to together to think about what these action plans might look like. And again, to normalize that progress is not going to necessarily be just in a straight line. All right, so again, this will be one of the last slides for before we get into resources, but I just want to put this here. Again, we don't have the time to jump into a ton of this, but I think that even if you aren't in direct service, I know we have a mix of folks who are directly working with patients and those who aren't, but I like this idea of what is our role. We want in these conversations to have older adults like lead, talk about the changes they want to make, but overall, if we're wanting to be advocating for healthy habits with any of our patients, but we're thinking about older adults for the context of this webinar, we as professionals can be strengthening our skills. We talked about MI techniques. We can be role models, not only in our clinics, but communities, thinking about changes to the community, to the environment that could aid in these goals that our patients have for nutrition or physical activity. And then, of course, we can make sure we know what's available in our communities and work on partnerships with those organizations to ensure that when a need is identified, we know exactly who we're going to go to next or where we're going to send someone to assist them in those goals. So just a quick plug for your role in this, and I hope that it's good food for thought. Tara, do you want to quickly just mention, I know we have some links here, the value of the federal nutrition programs?
Absolutely. So the Congregate Nutrition Program, I'm going to skip around here a little bit. The Congregate Nutrition Program and the Home Delivered Nutrition Program are probably going to be run by the same agency in your area. Home Delivered are the Meals on Wheels, and Congregate is a a great program in that it combines the food with this decrease in social isolation and programming, and it's very beneficial to one's mental health. The commodity supplemental food program is something else that is available in certain areas and certain communities. This year, I want to say, I think this is the 51st year of the Senior Nutrition Program, and that's what's under the Older Americans Act and supports the congregate and home delivered meal program. SNAP is huge. SNAP, the emergency allotments are ending this week, and there are going to be millions of older adults that are affected by this program. And the more we can get folks onto SNAP, the better their diet is going to be, the better they are going to be able to stretch their dollar, et cetera. My recommendation is to definitely look for a community outreach partner in SNAP. And I will put a little plug in for specifically Massachusetts. There's an additional program called the Healthy Incentives Program, whereas once you are enrolled in SNAP, you're automatically enrolled in HIP. It's a smaller dollar amount, and it allows you to buy additional fruits and vegetables every month. Yay. So take advantage of whatever programs you can. And that goes back to, Ariel, what I wanted to say was there's really no failing whatever the approach is. If it didn't work, great, then you just try a different approach. And this first resource in here is starting the conversation. It's a good flyer. You can just print it out and put it up in your room or carry it with you just to remind yourselves to start that conversation. There's a couple of resources here about different cultures in food in case you don't know where someone of a different culture can go buy healthier foods or preferred fruits and vegetables. So there's a couple of resources for a starting point for you, and whether they have diabetes or not. If they are interested in a traditional diet, meaning there's Latin, there's Native American, African diets, and these are all very healthy diets. There's meal plans, there's food lists in there. Cultural cuisines and traditions from the Academy of Nutrition and Dietetics is a decent place to start as well. I think in every webinar we'll mention My Plate Kitchen, which is another USDA site. And I love this because this link here will take you right to the list of recipes where you can sort by cuisine and the type of cooking equipment somebody has. So if they only have a microwave, you can find some of the recipes, and the recipes are typically, for 2 or for 20. It's a great resource. And then I will take a second and plug my own checklist, which was the Nutrition Community Checklist. This is specifically for Massachusetts, but I encourage everybody to take a look at it. And it helps you create a very tailored plan in your community so you can figure out where those resources are. And if you're in a different state, I'm happy to work with you on that as well.
Yeah, I have this slide in. I know we're almost out of time, specifically because I love Tara's checklist so much. And I know that she's updated it through a few iterations based on COVID and other items, but I think it's a great starting place. If you are not familiar, if you're not feeling super familiar, or there might have been things that have changed in your community as far as available services and programs, it's such a great reference, even if you're not in Massachusetts, to see kind of where there might be comparable programs in your state or your community. And that's going to be so essential, in addition to some of the federal level stuff, understanding who your partners might be. That's going to be such an important part of wrapping up those conversations with your older adults. So I know we're just at time.
And I will,
yeah.
Yep. I'll explain the slide. And that is, if you, with the dentition, I was saying earlier, you might not be sure why someone is choosing the applesauce over the apples, but you can use all of these resources and tools and questions to help try to figure that out, to have a better conversation with your patients.
Excellent.
And thank you for having me.
Yeah, thank you so much, Tara. I appreciate putting your contact information here. Yeah, if folks have questions about their state in particular, we can do some follow-up. I know we're just about at time. We do hope you'll give us some feedback. We hope you'll come back for other learning opportunities. We appreciate those who are sharing in the chat today. And if you find any other reflections or questions after we wrap up, feel free to send us an email. Thank you again so much, Tara, for your time and expertise. And thank you all for joining us. I know we'll have some folks watch the recording as well, but thanks all. Have a wonderful rest of your day.
Thanks, Mina, and good luck, everyone.
Thank you.